now, we're actually here to talk about World Heart Day, which is coming up on September 29.
Exactly.
Yes, and of course, whether you guys are aware or not aware, heart disease is actually on the rise in Malaysia, making it the principal cause of deaths among our nation. And within heart disease, actually statistics show a spike to 17 percentile of medically certified deaths, and I'm sure the number has increased to this day. And I've just confirmed with Doctor as well. We have our guest on the show that the number certainly has increased. So of course, in conjunction with World Heart Day that is coming up, like I mentioned, on September 29th, there are actually many ongoing initiatives to raise awareness on this. We've seen a lot of marathons coming up, people promoting, a lot of conglomerates promoting it as well. And so do take part in those in support of its importance. And of course, we're here to do the same and to share on how we can walk towards a healthy Malaysia, but we cannot do it on our own, of course.
Yeah, exactly. We need everyone's help. Hence why we have someone who is definitely well-versed in the topic that we have today. We have in the studio Dr. ADLI AZAM MOHAMMAD RAZI, consultant cardiothoracic surgeon from the UiTm specialist, UiTm Private Specialist Centre, UPSC, to talk about World Heart Day. Assalamualaikum, Doctor. Thank you so much for coming down together with us. Hashtag Use Heart. That's actually the theme of this year's World Heart Day on the 29th, as mentioned by Erin. So we do want to ask you a very, very critical question, which a lot of people don't know. Why is it important to have a healthy heart?
It is a critical question.
Yes.
It's a very important question, I suppose. That's why we have World Heart Day.
Yeah.
Even in our culture, you have something like simpulan bahasa jantung hati. It's important, right?
Yeah.
You are my jantung hati.
Yeah, of course, you are my jantung hati.
And you have something like a proverb, dari mata turun ke hati. Why it is so important? Because we know how heart is so important. It's very important. And it's not the heart itself. Either the heart, if you have a healthy heart, it's also important to have, is it anything associated with the heart? If the heart have problem, is there any complication or sequelae coming from the heart? So that's why I think in Malaysia we have, like as mentioned before, 17% 17% of our population death because of the cardiovascular disease, and in the world actually 32%. It's the highest in the world and in size in Malaysia. And if you talk about heart disease, the most important is what we call as cardiovascular disease, which is ischemic heart disease related to what we call as coronary artery disease, the supply to the heart. Although we have other type of heart disease like inflammation, infection, congenital heart disease, and so on. So if your heart have problem, it will affect other organ. If problem go to brain, you got stroke. Go to the heart, you get renal failure. Go to the other distal organ, you get other those problem.
Yeah, that's the thing, because like if you look at our anatomy of the human body, the heart is, I mean, hence why it's the heart. It is very, 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 very important to our livelihood. So when something is affecting the heart, like it or not, it will affect any other parts of your body as well. As what you have mentioned, Doc, the brain. No, it could damage the brain by stroke, as you mentioned. And it can also hit you in other ways more than one. So
and that's why the heart is also the most complicated organ part in our body as well. But actually talking about all this, and Doctor, you've also mentioned about how there are a lot of effects when it comes to heart disease. But in general, actually, there's a lot to learn about. Can you tell us, please help our audience at home understand as well. In general, tell us about heart disease.
As I mentioned before, the commonest is what we call ischemic heart disease. You have your heart, you have on the heart, you have what we call blood supply to the heart. You have 4 chambers with valve and so on. Each of the part of that can have problem. So of course, the coronary artery disease is the common, but you can have infection that can cause to the chamber, and this infection can spread throughout the body. You can have, because of this failure, this infection, this coronary artery disease, the heart will fail. And again, if the heart fails, you get other problem. And it's not just a problem of producing good volume to the other tissue, but it can cause other problems. For example, what you call arrhythmia. Arrhythmia, the heart rate is not normal. It can be too fast, it can be too slow. It can be what you call arrhythmia. For example, if you feel your pulse now, your pulse should be sound like tuk, 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 right?
Correct.
But it can be This is a reason that patient can have a blood clot in the heart and transfer to the brain and get stroke. So this kind of problem that we see in the heart, we learn in the heart, that may manifest if it's travel to other organ and so on.
I'm actually feeling my pulse right now.
Right.
Wait, I don't have a pulse.
Don't do that.
I think that's important question, because when you say the heart is important, you know that you are you're still living when the heart still function. And you say patient is die when the heart is stopped. It's only one condition when the heart is not stopped, but you say patient is die, what we call as brain death. That's a different issue.
Yeah, that's a
but
different
otherwise,
issue.
to confirm a patient is already passed away, is died when the heart is stopped.
That's why we're going to have a neurologist together with a cardiovascular disease surgeon together with us to talk about that. All right. So we've basically covered, what is the general idea of a heart disease. Now, what's more important to me, at least, for what I want to know, is that what are the things that I should be mindful of in regards to symptoms as well as signs for me to know that, I might have this. I need to go and get myself checked very, very quickly. So what are the tell signs that I need to be mindful of, Doc?
It's always, everybody talk about chest pain, breathlessness. I think that's common presentation that a person can have if they have what you call that heart disease. Of course, chest pain, breathlessness. There are other symptoms, for example, excessively sweating. And again, you have to see yourself, because you have a risk factor for that or not.
Right.
For example, you have diabetic, hypertension. If patient will have diabetic, they can present without chest pain, but more on breathlessness. They can just present, some patients they present with, they call it upper abdominal or lower chest pain, like gastritic symptom. It doesn't look like heart, but actually it's heart-related symptom. So this kind of thing that we have to aware, either this is heart or not. Some patients come to me, they just feel like blackout, but it is related to the heart valve.
Yeah.
So, of course, the commonest is chest pain and breathlessness. But again, if you don't feel comfortable, you have a risk factor to get heart disease, for example, diabetic hypertension, hypercholesterol, obesity, you're smokers and so on, then you should come forward and let be investigated.
And of course, guys, as Doctor has mentioned and shared with you all, if your parents as well, if they, if they, they're smokers, or if they have diabetic patients, and so far, as Doctor has shared, please do take a look out for any signs and symptoms if they're relating to heart disease. And don't neglect yourselves as well. No matter how young we could be, we could also be exposed to it. Because Mior was like, I personally want to know, but I want to know as well. She just pointed to herself. Okay, I just love that. But of course, yes, do look out for all those signs and symptoms, and do get medical attention immediately. And of course, Doctor, when you mentioned all of that relating to chronic diseases, heart diseases as well, what should we do if we experience those above symptoms that you have mentioned?
Of course, you should present yourself to the related and respective doctor or physician or specialist to be investigated. Most of the time, patients with underlying diabetic hypertension, they already have follow-up with their doctors. And doctor, most of the time, have follow-up and do monitoring investigation to exclude all this heart disease. And for example, they already on diabetic hypertension medication. If they have some sort like atypical symptom, which is not typical, so the respective physician can do some investigation for that. But for us, we will say more than 40 years old, if you have no other medical illness, go for screening. That's one of the advice. But you have to be careful, you have to be mindful. Because some of my patients, they come, my youngest patient that I perform CABG, atau coronary artery bypass surgery, my youngest is 36 years old. This is not something which is common we see now. And for the last 1 year, I've operated up to 5, 6, less than 40 years old. If I say and I tell you that screen at 40 years old, you have to be mindful. Am I a smoker? Do I have symptoms? Then you should be present early. So of course, after 40 years old, now we have lots of centers. They provide and give all this package for heart screening and so on, together with UiTm.
Mio's pulse must be like after
Yeah, she
hearing
checks
what
my heart rate
doctors
every single day just to make sure everything's fine. But it is so true, Doctor. I truly, truly believe in you in saying that this killer, when you talk about heart disease, is not ageist in the sense that it doesn't really matter how old you are. Sometimes, even if you practice the healthiest life, sometimes it creeps up on you in more ways than one. So it is very, very scary, and it is quite important for all of you Malaysians out there, as what the doctor has mentioned, factoring all of the other matters, putting into that as consideration. You should get yourself checked, to make sure that you get a clean bill of health. Getting that clean bill of health, unfortunately, sometimes you have to be reactive rather than proactive. You need to get treatment. You need to get yourself sorted out. Apart from IJN, obviously everybody knows Institut Jantung Negara down in Jalan Tun Razak as the main, to my understanding, at least the main heart center in Malaysia. Where can Malaysians can actually go to get themselves treated and get all the facilities to treat heart diseases?
When we talk about treatment for heart disease, you can divide as primary, which is prevention most of the time. You have a treatment, and you have so-called palliative, which is nothing much can be done. So, you have primary, secondary, or tertiary.
Okay.
And of course, National Heart Institute, IJN, they provide more on tertiary service. And you have all this for what you call even Pusat Kesihatan. They do provide all the screening program, what we call that a treatment for baseline diabetic hypertension and so on, straightforward heart disease. And of course, many medical center, even hospital, provide the treatment at the primary and secondary level. Of course, when we talk about treatment, it's just not medication, but it's about lifestyle. You need some time to sit down, talk, chat, spend. You have to stop smoking, you have to take care of your diet, you have to lose your weight and so on. So that takes some time. When you go to, for example, I work in National Heart Institute before. So when you go there, the referral is for bypass, to change your valve. It's basically surgery. But we are talking about beyond that, before that, it's prevention, which important at the primary level and the secondary level. As your question said, where? I think most of our health facility provide the service of at the primary and secondary level.
And of course, you guys do take note on the place that you live, where are the nearest you can, of course, get proper treatment, and if they have proper facilities available to treat your say if you have experienced any symptoms relating to heart disease, do get proper treatment, and of course at the nearest. And talking about all this, Doctor, we just want to know which heart diseases actually require surgical intervention.
Oh, this very wide.
Very wide.
And also a follow-up to that. And also a follow-up to that question: is surgical intervention necessary?
Why don't I answer that?
You want to answer me first? Sorry, I told you
because the answer no, because there are heart disease that can be treated with medication only. And you have to remember something. If you read, maybe go through a few articles, they will say that heart disease is incurable. It's not curable. It's only preventable and treatable.
Okay.
So that's the thing. When the damage is there, it's not curable anymore. So it's mainly to control the symptom and so on. So we have to take that statement with a pinch of salt. But otherwise, when you say, what you call it, can you repeat back your question about the
heart diseases?
Okay, require surgery. You can go by age. For example, the congenital heart disease. Have you heard of hole in the heart? So the one is treatable with...
That was because the guy just, broke up with the girlfriend. No, hole in the heart. No,
breaking heart.
Sometimes they're born with it, right, Doctor?
Yes, and that's not a very complex situation, and they have lots of range of disease that require surgical intervention. And then you have what we call mechanical problem with the heart. I keep mentioning about valve and so on. So this valve is very important structure on the heart. So you need to repair, you need to replace. It can due to infection, it can due to inflammation process and so on. And the commonest, I think, heart surgery is performed in this world, actually, coronary artery bypass graft, which is related to ischemic heart disease. When the coronary artery disease is stenosis, constrict, so you need to bypass whatever disrupt the flow of the blood. So again, not everyone is subjected for surgical intervention. They may have that kind of presentation or what we call indication for surgery, but they are not fit. So you have to weigh the risk and benefit for surgery. I mean, I look at you, you're very strong, and so, okay, we can go for surgery. If you are already 120 years old, you have renal failure, your heart function is very poor, the surgery may make your life shortened. So I think every decision for surgical intervention needs to be discussed, need to understand what is the pro and cons, risk and benefit, and of course, whatever decision that we make have to be the best for the patient, of course.
Right. Okay. Why? Who hurt you, Mio? Sometimes you have hole in your heart.
Yeah. No. It had a few holes before, but I patched it up quite a bit. So, but one thing, last thing, before we actually end this this segment together, I know that a lot of people have heard this many times, but I just want you, doctor, as a professional, to remind our fellow audiences what are the things that they need to do to prevent themselves from being a heart disease patient, I guess. Please, scold them, tell them. No, not scold. Tell nicely.
I mean, of course, if you talk about the commonest heart disease, which is ischemic heart disease, if you see the risk factor, most of the risk factor is modifiable. I mean, it's about our lifestyle, diabetic, hypertension, obesity, stress life.
Yeah.
So when you too much stress, it doesn't good for your hormone. Bad hormone come out, your chemistry is not good, poor sleep, bad diet, and so on. So we come back to normal, good lifestyle. I think we will avoid not just heart disease. There is a lot of disease that you can avoid. I think have fun with your life, not having fun until you forget about your responsibility. But be cool, like me.
All right.
Lovely. And of course, like how doctor mentioned as well, because Kuala Lumpur is actually, if I'm not mistaken, the previous survey that was done, it's one of the most stressful, overworked cities, like the top. So you guys really do have to take a lot of precaution and in checking yourself in signs and symptoms. And of course, those who have illness as well, do get yourself treated. Thank you so much, Dr. Adli, for sharing with us today in conjunction with World Heart Day.
Thank you so much, Doc. #UseHeart